Hello and welcome. I'm Dr. Jack, and this channel focuses on helping you live a healthier, happier life through knowledge. And today we're going to be talking about a topic that is controversial and discuss why it's controversial. So something pretty amazing is happening in regards to, for the first time in a long time, it seems that both sides of the political aisle, as well as the right and the left, all sort of agree and disagree that maybe it was a good idea to pause the Johnson & Johnson vaccine rollout, or maybe it was a bad idea to have paused this. So for this video, we will jump into the details and look at why the Johnson & Johnson vaccine was paused by the FDA and CDC, as well as look at various statistics, and so that ultimately you can leave here making up your own mind as to whether or not the correct decision was made. So without further ado, let's jump into it. So to begin with, if you jump on the internet, you'll find this all over the internet talking about the details as to why this vaccine by Johnson & Johnson has been paused. And if you want to know more about this vaccine, I suggest checking out my previous video that I did on the details of the Johnson & Johnson vaccine and how it is different from the mRNA vaccine that was rolled out by Pfizer and BioNTech/Moderna. So please feel free to check that out. But the main reason it was paused by the FDA and CDC was that they found an incidence of cerebral venous sinus thrombosis. 6 women came down with this type of blood clot within the brain, and one of them passed away, and last I heard one of them was in critical condition, and they were all between the ages of 18 to 48 years of age. It all occurred after about 6 to 13 days after they had the vaccination. And at this point in time when this data was gathered, there had been over 6,850,000 vaccinations already in the United States with the Johnson & Johnson vaccine. And so what cerebral venous sinus thrombosis basically is that within the head you have arteries that send blood to the brain, and then you have veins which essentially drain the blood out of your head. To make a long story short, what cerebral vascular sinus thrombosis is essentially a blood clot in a part of the drainage system. And when that happens, it can lead to a hemorrhage or bleeding within the brain. And typically you would diagnose that by getting a scan as well as getting blood work. So let's get into who is at risk for this thrombosis or blood clot within the brain. If you look at the statistics, individuals caused by a CVSD caused stroke per year, it is about 5 people in 1 million people. And actually, if you look at individuals, unfortunately under the age of 18, it's about 3 in 300,000. And they have different risk factors, whether it comes to children and infants versus adults. And here you see that the risk factors are quite varied, from various diseases like sickle cell anemia to other various forms of blood cell issues, heart disease, as well as iron deficiency, infections, dehydration, head injury. All of this can cause this issue. And when you look at adults, it's a little bit different. Pregnancy and the first few weeks after delivery is a risk, as well as cancer, things like obesity, various vascular diseases, low blood pressure as well, and inflammatory bowel disease like Crohn's disease or ulcerative colitis, and various other blood clotting issues. And if we look at the actual symptoms, when someone gets this venous thrombosis, it typically can develop with a headache, blurred vision, fainting, loss of control over a certain part of the body, as well as seizures and coma. So one of the reasons for this pause was that there was concern about whether or not this was related to another phenomenon known as heparin-induced thrombocytopenia. And thrombocytopenia basically means that there is low platelet count, which was found in these individuals. And in the case of heparin-induced thrombocytopenia, heparin is a blood thinner that is given to patients for various medical reasons, and so it's normally supposed to thin the blood, but what you see in heparin-induced thrombocytopenia and thrombosis is basically that there's formation of abnormal antibodies that actually activate platelets. They actually end up developing new or worsening thrombosis, and the platelet count also falls as well. Now, one of the controversial parts about this is that if you look at the age range of the individuals that had this done, they are between the ages of 18 to 48, and the majority of them, if not all of them, probably do not go to the doctor regularly, much less have their platelet count drawn. And one of the questions that's being asked is that, well, these individuals, okay, they had this blood clot, but at the same time, they had the low platelet. However, did they have any lab data prior to that to show that there was low platelet count to begin with, even before they had the blood clot. Because one of the things you have to bear in mind are the causes of thrombocytopenia. And if you look at this, you can have decreased production, and there's a whole laundry list here of various things that can cause that, as well as increased destruction caused by a whole laundry list of other various reasons that can cause it. You can have all sorts of medications that can cause this as well. And there's various other things like Lyme disease or snake bites. And so there is a ton of various reasons as to why a patient or an individual could come down with low platelet count or thrombocytopenia. So that is just some background and data surrounding as to why the Johnson & Johnson vaccine ultimately has been paused right now. People that agree with this pause basically are saying that, look, this is fantastic. You know, this will show the public how there is a overabundance of safety here, and it will prove to people that, look, we're being so cautious about this that even though 6 people out of 6.85 million people that have been vaccinated with the Johnson & Johnson vaccine came down with this issue, we're actually going to pause it and look at it. So that's the argument on that side, that this will ultimately make people feel at ease and just show the due diligence of just how stringent they are being and how they are adhering to such high safety standards with the entire COVID vaccine rollout. However, there is another side to the story. So folks on the other side who think that this was overkill are people like Governor Howard Dean, who came out and said, I think the FDA went too far here. If there were a clinical trial of this size with this data, the drug will be licensed with the appropriate warning, and essentially they would move on. You also have Nate Silver, and for those of you that don't know, Nate Silver is an American statistician and writer, and he took to Twitter as well and has some pretty famous tweets that have made the headlines. And here he goes on to say, 6 cases out of 7 million people. What a disaster. This is going to get people killed, and it's going to create more vaccine hesitancy. These people don't understand cost-benefit analysis. They keep making mistakes by orders of magnitude. He goes on to say, why did the FDA recommend the pause anyway? Because of a combination of institutional culture, cognitive biases, and bureaucratic imperatives, incentives. They greatly overweight the importance of rare adverse effects relative to people dying from COVID. When someone commented on his comments on Twitter, he had this as a response. He goes on to write, I disagree. Say there's a 1 in 100 chance someone acquires COVID because of a delayed vaccine. Maybe conservative in the US where spread is still quite high, and a 1 in 150 chance that they die from it. That's a 1 in 15,000 chance versus 1 blood clot death in 7 million doses so far. So just to give some perspective in regards to these numbers, if you look at the odds of becoming struck by lightning, based on averages from 2009 to 2018, your odds of being struck in a given year are 1 in 1.2 million chances. And so the odds of being struck in your lifetime, estimated about 80 years, is about 1 in 15,300. And if we go on to look at some other statistics for a comparison, if we just look at the rate of the cerebral venous sinus thrombosis, and by the way, I got this image from MedCram, which is a fantastic YouTube channel. I suggest checking it out. All of this stuff is linked down below in the description for you to check out as a reference. But in the general population, you have about 0.5 per 100,000 a year who come down with CVST. And with COVID-19, per 100,000 COVID-19 cases, you get anywhere from 4.5 to 20 cases per 100,000 of developing CVST. If you're pregnant, it's on average about 11 out of 100,000 deliveries. And if you take contraception, it's about 2.7 to 40 people per 100,000. And for the Johnson & Johnson vaccine, if you break it down to per 100,000 vaccines specific to the Johnson & Johnson, it's about 0.09 per 100,000. So here I just pulled some other data just to share with you guys, and that's the amount of vaccinations that have been conducted already within the United States. So over 258 million doses were delivered, and over 202 million has actually been administered. And so they make a difference here as to the amount of people that have been fully vaccinated and the amount of people that have had at least 1 dose. And hopefully the vast majority, if not all of these individuals that got 1 dose will go on to get the 2nd dose, because that makes up nearly 39% of the population, which is fantastic. And so here in the United States, our vaccination rates are going up relative to the rest of the country, or relative to the rest of the world. If you look at this graph here from Our World in Data, you can see that Israel actually is the highest, followed by the United Kingdom and then Chile. And notice that India is down here pretty low, and actually India has made the headlines recently quite a bit because they actually are having a massive surge of cases there, with them approaching the highest death toll thus far since the pandemic started. And I just came across some other interesting data in regards to 2020. COVID-19 was the third leading cause of death in the United States. You have heart disease that killed 690,000 people, cancer that killed 598,000, and then you have COVID-19, which killed 345,000 people. So there you have it, both sides of the argument as to whether it was right or wrong to pause the Johnson & Johnson vaccine. Tell me what you think. Put it down below in the comments. Let me know. Do you think that it was appropriate for the CDC as well as the FDA to put a pause on the vaccine when the amount of people that actually have this blood clot, you're more likely, about 100 times more likely to be struck by lightning, and it was in an age group of females that, do we know if they were on birth control pills? Do we know that they had low platelet count to begin with, due to the laundry list of various causes that can cause something like thrombocytopenia or that low platelet? And what about the timing of this information coming out as well in regards to the amount of cases that are happening around the world and how they're surging, and also here in the United States, like Michigan, where you're seeing record number of children now being admitted and hospitalized due to COVID-19. Do you think that after doing this, out of quote unquote overabundance of safety, do you feel that, say, the CDC and the FDA allow people to go and get the Johnson & Johnson vaccine again, do you feel that people will actually go and get the Johnson & Johnson vaccine over, say, the Moderna or the Pfizer BioNTech, which, by the way, those two vaccines, those two mRNA vaccines, they are different in various ways compared to the AstraZeneca and the Johnson & Johnson vaccine. So if you want to know more about that, I suggest checking out my previous videos. I talk about why I think the mRNA vaccine technology is so amazing, and I talk about how I was sort of skeptical initially as well about the whole process, and because I knew that I'm a frontline worker and that I would be one of the first people to get it, I did my research and I did a video on essentially my conclusions of the mRNA technology so that people are well informed and feel more comfortable about how we arrived at the vaccine. I dispel some myths and everything else. So please feel free to check that out. And also know that the Pfizer and BioNTech Moderna vaccine, there has not been any pause and they have not seen any issues with those vaccines. I would say that to date, I don't know of anyone that's gotten the Johnson & Johnson vaccine. Everyone that I know has gotten either Moderna or Pfizer. So, even my patient population, all of them has gotten the Pfizer or BioNTech one, Moderna ones. But before I go, I do want to say that as you research and kind of formulate your own opinion about the whole vaccine process and the various vaccines that are out there, I think one of the things that you got to be careful about is confirmation bias. And confirmation bias goes both ways. So what is confirmation bias? Confirmation bias occurs from the direct influence of desire on beliefs. When people would like a certain idea or concept to be true, they end up believing it to be true. They are motivated by wishful thinking. This error leads to the individual to stop gathering information when the evidence gathered so far confirms the views or prejudices one would like to be true. I think it's also important to keep in mind that just because one event happened and some different event happened afterward, that does not necessarily mean that there's a link between the two. Even in my clinical practice, I've had patients, I would say, give them a hip or knee injection, and they come in and they would say something like, gosh, Doc, after you gave me that hip or knee injection, my shoulder really started to hurt. And I mean, obviously in that situation, it's just a coincidence. And so when you're talking about vaccinating billions of people around the world and having given out hundreds of millions of the vaccine, there are going to be events that occur afterward, and the vast majority, most likely, of those events would have occurred even without any intervention of a vaccine. And I mean, statistically, if you were to follow 100,000 people over a period of a year, 700 of those people would die due to various other causes. And so I think a lot of this is also important to keep in mind as you move forward and you kind of do your own research. So I hope you found this video helpful, and until next time, take care, stay safe, bye-bye, Pura Vida.